Welcome to Accessing Services. This session looks at how to enhance your relationship with a variety of healthcare providers. In addition to the informal or natural support network of family, friends, and people in your community that you have ongoing communication and relationships with, as you begin to access services, you're going to find yourself working with a variety of healthcare service providers. One of the roles of a family caregiver is to develop working relationships with the service providers, such as case managers, physicians, nurses, home support workers, staff at adult day programs. These people are also part of your support network. You can use the strategies listed on the coming slides to enhance those relationships and perhaps increase your chances of success in obtaining the services you seek. Although care workers have lots of expertise in their own areas, you are the person who knows yourself or your person living with dementia best. The very best care is delivered when care workers and family work together. It's helpful if you discuss directly with care workers about specific approaches or ways of care to help things go smoothly. That said, care may look different than you are used to, but both caregiver and person living with dementia will adapt. It's important to recognize that just because it's different than how you thought it would be, it is not bad. When you are planning for a meeting with a service provider, gather up a list of your questions and concerns and spend some time putting them into a priority order. It may be that there won't be enough time to get through all of your questions, so know which ones are key for you to discuss in this meeting. Emotions can be running quite high, so breathe deeply and be polite and respectful. However, respect doesn't always mean agreeing, and that you may need to be respectfully persistent in asking for services. That said, get the big picture and understand how the services you are discussing fit into the continuum of care and services that might be available to you. Advocacy simply means speaking up for yourself or somebody else. Time advocacy strategies carefully. Care providers coming into the home are on a schedule. Ask them whether you can have a few minutes or call and make an appointment to talk to your case manager to ensure that there is time to discuss your concerns. Be clear about what you want to achieve. You might even want to write out a bit of a script. The clearer that you can be about what you want, the better for all concerned. If you are calling about a concern or problem, try to have some possible solutions in mind. But be willing to compromise. Your solution may not be possible or even preferable, and by being open to compromise, you might find a solution together that is even better than what you could have imagined. One of the key pieces of advice when communicating with someone who is living with dementia is to avoid arguing. The same is true of working with care providers. Build a relationship with people in your home as best as you can to have trust and a good working relationship, and inform the case manager of changing needs for your person living with dementia. Think of yourself as part of a team with a role that you still have on that team. They are still the captain. They just have a bigger crew. Here are some tips for working with health providers. Acknowledge that they are doing well. Write down what you want to say before you speak to a provider. Speak to the person most likely able to make decisions regarding your concern. If you want to add a service or make a change on the care plan, speak to the case manager. Remember, you are not inconveniencing service providers by phoning them or requesting a meeting, for example, with case managers. It's the case manager's job to work with you to access relevant services. Advocacy is an important part of accessing services for a person with dementia. You may need to advocate to ensure that you receive services that support you and the person with dementia. These fact sheets offer tips on advocating for a family member with dementia. Getting organized includes several tips, such as making your own business card to hand out to service providers. Accessing Services Part 1 provides information about the home and community care assessment process. Accessing Services Part 2 offers basic information about residential care facilities in BC. Dealing with Conflict offers practical tips and suggestions for resolving conflict with healthcare providers. And Writing an Effective Letter offers tips for when you are considering writing a letter to solve a problem. It also includes a sample letter to give some ideas about what might be effective. You can find these advocacy fact sheets on our website at www.alzheimerbc.ca. Go to Getting Involved, then Advocacy, and then Self-Advocacy Strategies. The legal authority to make decisions. Remembering that dementia is progressive and eventually a person living with dementia will become incapable of making legal and healthcare decisions. Planning ahead of time is key, and it is important to have conversations with the person with dementia as early as possible so their preferences are known. When thinking about accessing services, it is important to consider personal planning. Personal planning gives the family caregivers confidence. They can know that they are doing their best to honor the person with dementia's wishes. Many families reach out to the Alzheimer's Society when they are in crisis. Often, they have not considered planning ahead. Our goal is to help motivate you to start thinking about personal planning now so that you can learn where to get the information and support. Now is the best time to learn about the tools that are available to you. Planning is best done in advance of any times of crisis. You can access the personal planning recordings on our website at www.alzheimerbc.org. This personal planning tips and resources sheet can be accessed on the Alzheimer's Society website. It gives you tips on how to prepare a file with your important papers and information. It also gives you links to financial and legal resources and health and personal care resources. These additional resources, such as BC Ministry of Health, HealthLink BC, Health and Seniors Information Line, the Public Guardian and Trustee of BC, People's Law School, and NIDIS Personal Planning Resource Center, can offer you information about health and legal planning. Thank you for participating in this recording. If you have any questions about the information you've heard here, or any other questions about living with dementia, please don't hesitate to call our First Link Dementia Helplines, Monday to Friday. For support in English, the line is available 9 a.m. to 8 p.m. And for support in Cantonese, Mandarin, or Punjabi, the lines are available between 9 a.m. and 4 p.m.